joint pains, arthritis, and inflammation. The Ayurvedic approach.
Welcome back to our wellness podcast. Today I am here, Dr. Parvathi, joined by Dr. Sandeep, an Ayurvedic practitioner with a deep insight on holistic healing. So today we'll be discussing about the topic that has been experienced by every one of us at some point of time. It's joint pain. It includes the wear and tear, basically osteoarthritis, to the inflammatory conditions like rheumatoid arthritis. Let's dive into Ayurveda and learn more about these conditions. Let's get some insight from Dr. Sandeep. So let's start with the basic question, Dr. Sandeep. How does Ayurveda explain joint pain and arthritis?
So in Ayurveda, joint pain is basically categorized based on the dosha imbalances. So the most common name you would hear is Sandhi Vata. So Sandhi means the joint and Vata means a type of degeneration in the dosha. So Vata is like a disorder where dryness, degeneration and even cracking joints, which are the main symptoms seen here. In inflammatory arthritis, we see ama vata, where that's the accumulation of ama or the toxins leading to swelling, stiffness, pain and systemic symptoms. So it's more than structural damage. We evaluate the gut, Agni and lifestyle. Ayurveda doesn't just see cartilage loss, we see a metabolic and digestive disorder.
That's very interesting. So how is ama playing a role here again?
So yes, in fact, more than 70% of chronic joint cases I see, ama is the hidden culprit. Even in autoimmune types of arthritis, the root cause lies in the faulty digestion or toxin accumulation and immune system confusion. So the sticky, cold, heavy nature of ama accumulates in the asti or the bone and the majja or marrow part of the tissue, particularly when the vata is high, may cause a lot of symptoms which we have to detoxify before nourishing the joints.
What about the swelling and the inflammation? These we deal in allopathy with NSAIDs and steroids.
So Ayurveda, we use a more layered approach for the concept of ama. Basically the ama has to be digested out from the body or cleansed out from the body through the srotas or the channels. So this is done through a combination of classical anti-inflammatory formulations and dosha balancing treatments, which are powerful anti-inflammatories. So externally we apply medicated oils based on the condition and the dosha presentation, and this results are slower than steroids but longer lasting and without organ damage.
And in osteoarthritis, the wear and tear type, is regeneration possible?
So regeneration has always its limit, but what we can do is slow down the degeneration, lubricate the joints, improve the function and reduce the pain. So basically vata pacifying or reducing oil therapies and nourishing therapies like matravasti or the enema in Ayurveda is a very important treatment, and piju and abhyanga are basically lubricating line of treatments. We combine this with the food that supports bone tissue like sesame or ghee, turmeric. These are other types of food that helps in this.
How do you decide which therapy a patient should undergo?
So every case is personalized. So we have to first assess the level of vata, the level of ama, and to what level inflammation is dominant in the condition. Based on that, we have to create a sequence starting from correcting the digestion, then to panchakarma if required, and then after that we do the rasayana or rejuvenation. So for example, a thin woman with dry crackling joints needs oil and nourishment, while a middle-aged man with the red hot swollen joints needs detox and anti-inflammatory or cooling therapies. So like you would understand, no two arthritis cases are treated the same according to Ayurveda.
Do lifestyle and emotions play a role in the joint issues?
So very much. So vata disorders are worsened by overstress, workload, irregular routines and even excessive travel and anxiety. So emotional rigidity often reflects in physical stiffness. That's the reason why Ayurvedic treatments is never just physical. It has to have a mental part to it by calming the nerve system, also doing treatments like Shirodhara, oil massages and integrating food which are more grounded in nature. Along with that, we do treatments like yoga, pranayama, and then sometimes emotional counseling is also required.
Last but not the least, what would you recommend to somebody who's experiencing early joint pains?
So my recommendation to anyone who's experiencing early stage, like signs of crackling in the joints, stiffness, or even pain after exertion, especially in cold weather, you should always begin with a daily warm oil massage, mainly in the body and the joints, and avoid too much of raw and uncooked food and cold food, and especially refrigerated ones, and hydrate well, reduce your stress. So if you have any of these symptoms, it's always good to consult an Ayurvedic doctor. And like the old saying goes, prevention is always better than cure.
Thank you, Dr. Sandeep. That was very enlightening. We could get a clearer picture of joint pain in terms of Ayurveda, how it is actually connected to digestion, detox, emotion, and in our mental health. Thank you.